So this is James, a 68-year-old fit man, done a lot of swimming, but you can see how his upper body is curved forward from high waist level, so he's carrying a lot of weight in front of the line of gravity. When he bends forward, can you go forward, James, for me, touching your toes? You can see how he's very humpy here in his thoracic spine. And then coming up, James, and then go backwards, and you'll see how he's hardly got any extension. Oh yes, flat as a board there, and that's enough. What he's doing is getting pain over into his right iliac crest. If you can just point out where you're getting your pain, James. And that is coming from L2. I'll show you in a minute. And then if you can point into your butt there, James, he's also getting pain from L5, facet joints. So let's get him onto the floor. Can you lie down for me there, James, and I'll show you what I'm doing with him. First of all, I let him lie flat, and you can see this area here where he's got discoloured skin, and this is where when he sits in his seat, there's abrasion. And what I'm doing here is mobilising L2, which is the point of maximum crumple and fulcrum. And his whole, he's done a lot of swimming, he's got a very big upper body, he's been kept fit by swimming, but that's pulling him further forward. Intuitively, James has done a lot of backstroke, half-half, because he knows that his spine needs to be straightened up. Now what I'm doing here is mobilising L2 from right to left, but he's also got a facet problem at L2, 3, and that gives him the pain. Painful there, James?
A little.
Yeah, and that gives him the pain over here. But he's also got a problem down here at L5, centrally, and he's got a facet problem at the L5S1. So what I'll be getting him to do, which he hasn't done a lot of, is thoracic back block, but also I'll be mobilising him up in Sphinx. So just come up onto your elbows there, James. And you can see here that L1, 2, 3 does not want to sag through. It's like a plank. So what I'm doing with mobilising is gently pushing from right to left. It's very different pushing from right to left in terms of end feel from when I go from left to right. Left to right's happy to go, it swings through. Still a bit of a plank there, doesn't want to do a PA direction at all. This is what he needs in the way of treatment. From right to left there. Onto the facet, bang. Different pain on the facet. And different pain on that facet, L5. But the main thing too is that I will be getting him to do the thoracic back block. Now, but James has been following me for years. Now lie flat for me then again, James. He's been following me for years, not realising that all that time when he was doing his lower back block, he should have been doing his upper back block too, to help this here. I won't show you the upper back block being done, because there's lots of videos on that. Now this is usually a problem that women get of a certain age, because breast tissue becomes more dense after menopause, it pulls people forward. All of us as we get older are pulled forward. And there we go. He'll carry on with this at home just by doing his floor twist to open up here, thoracic back block, lumbar back block. There we go.